Hello, welcome to Code Rhetoric with Tam Talk. In this session, we will be discussing sepsis due to a post-procedural infection. Our ICD-10 General Coding Guideline states, in letter A, the documentation of a causal relationship. As with all post-procedural complications, code assignment is based on the provider's documentation of the relationship between the infection and the procedure. In letter B, sepsis due to post-procedural infection. For such cases, the post-procedural infection code, such as T80.2, which is infections following infusion, transfusion, and therapeutic injection, T81.4, which is infection following a procedure, and T88.0, infection following immunization, or O86.0, infection of obstetric surgical wound, should be coded first, followed by the code for the specific infection. If the patient has severe sepsis, the appropriate code from subcategory R65.2 should also be assigned with the additional code or codes for any acute organ dysfunction. Our ICD-10 General Coding Guideline further states for letter C, which represents our post-procedural infection and post-procedural septic shock, in cases where a post-procedural infection has occurred and has resulted in severe sepsis, the code for the precipitating complications, such as a code T81.4, which represents infection following a procedure, or O86.0, which represents the infection of obstetrical surgical wound, should be coded first, followed by code R65.20, which represents severe sepsis without septic shock. A code for the systemic infection should also be assigned. In our first coding example, our patient was diagnosed with a local infection due to the central venous catheter, as well as severe sepsis due to that infection. So in our first book step, we're going to identify our local infection, then drill down to catheter, and then drill down to central venous, which represents the type of local infection based upon the central venous catheter. Our ICD-10 CM code should be T80.212. In our second book step, our diagnosis is sepsis, and then we're going to drill down to severe, which represents the type of sepsis. And our ICD-10 CM code is R65.20. In our rationale, our patient presented with an infection of the CVC, or a central venous catheter, as well as severe sepsis. So per the coding guidelines, we are to assign the localized infection as our primary diagnosis and our severe sepsis as secondary. Therefore, the coder should assign code T80.212 as our primary diagnosis and R65.20 as our secondary diagnosis. So in our next coding example, our patient presents with enterococcus due to the infected cesarean delivery wound following delivery, as well as severe sepsis. In our first book step, we're going to locate the ICD-10 code for our infected cesarean delivery wound. Our ICD-10 CM code is O86.0. Our second book step, we're going to identify the ICD-10 code for the enterococcus. And that ICD-10 CM code is represented by the letter B, 95.2. In our third book step, we're going to identify the ICD-10 code for severe sepsis. So we're going to identify sepsis and then drill down to severe, which represents the type of sepsis. And our ICD-10 code is R65.20. In our rationale, again, our patient presented with enterococcus due to an infected cesarean delivery wound following delivery, as well as severe sepsis. Per our coding guidelines, we are to assign the localized infection as our primary diagnosis, and then assign codes for the type of infection and severe sepsis as our secondary and tertiary code. Therefore, the coder should assign code O86.0 as our primary diagnosis, the B95.2, which represents the type of infection, which is the Enterococcus, as our secondary, and then R65.20 as our tertiary or third diagnosis. In our coding tips, our first one is to always remember to code the postoperative infection as a primary, followed by the type of infection, if known, and the appropriate code from our subcategory R65.2, which should also be assigned with the additional codes for any acute organ dysfunction. Remember to always code to the highest specificity. And lastly, when in doubt, always reference your coding guidelines or query your healthcare provider. This concludes our segment of Code Rhetoric with Tam Talk. To learn more, please subscribe to our YouTube channel at Abraham Medical Coding Coach Abraham, or visit our website at www.abrahammedicalcodingcoachllc.com, and be sure to follow us on Facebook, LinkedIn, and Instagram. Thank you.